Hello everyone and welcome back. Yeah, technically, if you have not seen the other video about internal medicine clerkship review, feel free to watch that. That's the first department I went into. But today I'll be sharing my experience on the pediatrics rotation review. Towards the end of 2025, I was doing my rotation in the Department of Pediatrics. And pediatrics is basically a department that focuses on treating and managing ill patients that are children. Usually it's from birth until the age of 18. So during this time, I went to the hospital in Canon. The daily routine that we had at Canon was we were expected to be at the hospital at 7:30 a.m. every day, and we would go till 5 p.m. every day. We would then have our morning staff meeting at around 8. And that's where we have our meeting sharing information from the night shift till the day shift that we are coming in to do. So the night shift will then share all the most important information like new admissions, new developments for patients, whether they're progressing towards health or if they're deteriorating, and we need to focus on them during the day. So that's where we share the insights and in the end work towards bringing a patient back to health. Now, sometimes we have presentations in that time where students are expected to share a case that came in during the night shift. Usually these cases, they vary. Some are quite intense, but some are quite, the usual. And then we'd have a short discussion on that and sometimes be quizzed on it by the seniors, which really pushed us to prepare good presentations, because it was not just like I come and I give you information about a patient, 5-year-old male patient came with No, I need to come with an in-depth understanding of the condition so that when I am asked by a senior resident or the consultant, I need to be able to somehow explain why certain plans and treatment approaches were used. After that was done, after we were done with such a meeting, we would go on to have our pre-round, which we had about like 30 minutes, a bit more on a good day, where we go to our different departments to get either the full history of a patient, or just the progress notes on how a patient is doing on this particular day. Yeah, so in that time we go into our different departments. There's either emergency, you're in ward, or you're in neonatology. Neonatology, which can be called neo in short, basically is a subspecialty in pediatrics where it focuses on the sick newborn babies or premature babies. Thereafter, the senior would come, the consultant on duty would come, and we go through all the patients and present the cases, present the information we've been receiving for the different conditions, for the different cases, the progress, and we share that information and together try to come up with a diagnosis and a plan. So thereafter, we would go and then we were given the responsibility of ensuring that the notes were up to date. This meant we would then, if changes need to happen with regard to medication, we would ensure that it was documented, and we would inform the nurses, then speak to residents when it came to time of getting consultations from other departments, be it cardiology or surgery. And it was quite busy in pediatrics. We were always busy. We needed to ensure that work was done, but we had a lot more responsibility, which was nice. And we got to practice a lot and engage more with patients. This I saw during my time in pediatrics was the case of tetanus. It's a condition caused by a bacteria called Clostridium tetani, which causes tetanus. And tetanus is a condition that muscles are contracting as a result of a neurotoxin that is preventing inhibitory signals to the muscles. So basically, there's signals going to your muscle to contract constantly, and there's nothing to tell the muscle to relax. So the patient is constantly in spasm. And Honestly, I never thought I'd see such a case in my life. You hear about this in like the beginning of med school, and you learn about it. We have vaccines for it. However, I think this patient had never taken the vaccine, and he went to a place to get circumcised. Equipment may possibly not have been sterilized and or properly cleaned. This resulted in him developing tetanus, and it was quite severe. One thing I've learned, or at least something funny that I noticed with myself, I find that I'm very scared of very small babies, premature babies. I feel like they're so fragile. One wrong move and bruh. So there was a case where there was a mom who brought a baby was not feeling well. It was a newborn baby and premature. Because of this fear, I didn't know how, because you never know, am I being too rough with the baby? Am I being too gentle that I'm not able to do my work? So it's like trying to find that balance. I was still trying to figure it out. I was scared to just hold the baby for fear of dropping him or accidentally, injuring the child. I didn't, I don't deal with babies often, man. So anyways, I went in and I'm trying to be so gentle, but the mom is looking at me weirdly like,
are you scared?
Man, the aura points I lost, man. I thought I was being composed. Trying to act natural. And just when it got to physical exam, I think that's when she saw the confidence going down. But obviously with time it came. I became a lot more comfortable with the babies. I managed to overcome that fear of, small babies and hurting them. That was a cool lesson I learned. Unfortunately, aura was lost, but knowledge was gained and skill. So if you're about to go into pediatrics to do any sort of clerkship, just remember that drug administration or prescription is not the same as within adults. They more or less have a set dosage for their medication. Whereas for pediatrics, it's based on the weight of the child and it changes. Obviously, the weight of the child changes a lot. So we constantly have to have the weight of the child in order to make the proper prescription that is effective and useful. Be ready to learn. There's a lot. Be ready to calculate. There will be a lot. But I would also say do your own research when it comes to certain conditions and the management. Always try to, you'll find a case that you may have never seen. Remind yourself of information as you go. Within pediatrics, there's a lot of tools and stuff that you'll need. One thing that I've noticed, apart from your stethoscope and the usual, have a tape measure to measure the anthropometric measurements, the head circumference, height, the weight, and you get to check where do they stand on average to the normal growth of a child for their age group, and that is something you're always going to constantly be checking. That is my experience in pediatrics. I thoroughly enjoyed it. If you have any further questions or any wishes as to what you want to see on this channel, please put it into the comment section below, and together we can learn and I can share what I know, and I hope that you watching will share what you know on the comment section with our other medical colleagues as we go through this medical degree together. Stay safe, study hard, and I'll see you in the next video. God bless.